Hey guys, Dr. Justin Marcagiani here. Welcome to Beyond Wellness Radio. Really excited for today's guest, Allison Samon. Allison's website is chronicillnessrelief.com. Allison sees lots of patients from all over the country dealing with autoimmune and chronic gut and mystery illnesses. We're going to have a nice podcast discussion on that topic today. Allison, how you doing?
Hey, I'm so great. So happy to be here with you. Big fan of this show.
Oh, awesome. Excited that you are a part of it. That's great.
Yeah,
Well,
yeah.
first off, I've always liked to understand how practitioners got to where they're at. Usually there's this kind of healing journey where they had some kind of a health issue or a challenge, and that challenge kind of inspired them to kind of go to a higher level. Usually you kind of knock on the door of conventional medicine and you're like, all right, well, this many drugs and symptom treatment, you're not really getting to the underlying issue. How did that journey unfold for you? That's kind of how it unfolded for me. But what about you?
Same. That was my story exactly. I kind of always thought of myself as a health and fitness enthusiast, but I really didn't know what the heck I was doing or talking about. And it really came to a head when I began having chronic pain. And it started in my
Mm.
knees. I did have an injury. This was in college. I had a skiing accident where my
Mm.
ski went one way, my knee went the other. So ouch. But
Ow.
the difference. Yeah. You know the difference though between an ouchie and something's wrong. And so I think that was like an initial tear, but then I healed because I was young and you just heal from things. But then that summer I ran a race in the morning and I waitressed at night. And when I woke up from my nap after the race, I was limping. And I was like, oh, okay. I probably twisted something while I was running, taking a rest, made it swell. But a couple of weeks later, I'm still limping around. And I
Mm.
go to the doctor, and what I was told, and this became a theme for several years, you're young, you're athletic, you're fine. And I'm like, I don't think this is fine. This doesn't feel fine. And so that's just where it began, was in my knees. But then it started to be in my lower back where I couldn't sit very comfortably. I was always just like, what's wrong with this chair? And blaming everything. I was getting into that place, the
Mhm.
blame and just misery. And then my butt. So sitting was uncomfortable. And physically sitting was uncomfortable. So like chairs were uncomfortable, and also just the act of sitting was uncomfortable. I had
Mhm.
this like dull ache in my butt. And so saw neurologists,
Mhm.
chiropractors, physical
Mhm.
therapists. I did everything everybody said. Nothing was helping. I had neuropathy in my feet. Like it just kept manifesting into something else. Migraines, hormonal imbalances. And nobody ever talked to me about anything that actually was going to move the needle. I thought that they were. And then finally, I met somebody who asked me about what I was eating. And I was like,
Mm.
why? Like, why are you asking that? Of course, I eat healthy. And my mentality at that time was, if you're not fat, you're healthy.
Right.
Forgetting that, I didn't think that I was constipated. I thought it was okay that you only go like once every 2 or 3 days because you're busy. I
Right.
worked in television at the
Right.
time. I didn't want to go
Right.
poop at work. Like, who does that? And like,
Right.
I didn't
Right.
want anybody I was dating to know that I went to the bathroom. Like, that's crazy. So I
Yeah.
was I was fine with it. I didn't realize how toxic I was.
Yeah.
And that was showing up in all of my symptoms, the
Mhm.
fatigue and the mood. And so I finally was like this, that how I was eating or not eating was actually impacting how my body felt. And when I went home so it was an alternative practitioner.
Mhm.
Basically, he was doing muscle reactivation,
Mhm.
and he was the first person to ask me about my diet and to consider, well, what if you don't drink orange juice? I hated orange juice. I was only
Mhm.
doing it because it was healthy.
Right. Right.
What if you don't drink orange juice and have an orange instead, or have strawberries or broccoli for the vitamin C, not orange juice? And I was like, oh, okay, crazy man. And the next day, my knee didn't hurt. And I'm not saying that that
Mm.
was the solution to all of my problems, but it was the first step, and the first like light that I saw was, wow, if
What other
that can
foods were you pulling out? Was it just oranges? Because that seems like, yeah, I mean, there's a lot
orange
of sugar
juice,
there, but what else?
orange juice. So orange juice that came out.
Yeah. So a lot of
And
sugar, right? There's You got the sugar of 8 oranges in 1 cup of orange juice, so there's a lot of sugar there, so that makes sense.
Yes.
What else?
Well, and I was having that with Special K.
So
So
gluten? Yeah, a lot of gluten.
and this was the fat-free. Everything was fat-free. And so if you don't have fat in something, what is it going to have? Sugar.
More carbs, typically. Yeah.
More carbs, more sugar to give it
Yep.
flavor. And I worked in television, and I don't drink coffee, I don't drink soda, don't smoke cigarettes. That's what everybody does to have the energy to sustain. Well, I didn't
Right.
do any of that stuff.
Right.
So what did I need for my energy? Sugar. And
Of
that was
course.
my drug. That was my drug of choice that I gave me energy, false energy, temporary bursts of energy. And also, when you work really long hours, you miss out on some social things. Plus, my body was starting to fall apart. So I was missing out on even more.
Right.
And I was also self-medicating with sugar because it made me happy.
Right.
False of happiness. Right. And so there was a lot of, I'm a junkie. This is what I like to say. I'm a reformed junkie. And I didn't realize just how much I was eating and how addicted to it I was, thinking that if I had these lean cuisines and I had these, healthy fast food, I could eat these fat-free, low-calorie things, not really realizing I wasn't giving myself nutrients. And it
Right.
was evident in all of the ways that my body was
So
presenting
you're
itself.
consuming a lot of food allergens, right? A lot of extra sugar. And then
Mhm.
was that just keeping your body more inflamed? So then this injury that happened while skiing was just kind of really, yeah, it was something, but with the inflammation being in the background, it kind of made you more susceptible to experience all the pain. Is that what you're saying?
I would think so. I would think so.
Yeah.
Obviously, I can't go back because nobody,
Yeah.
at the time. But yes, that is my theory, is that I would have had the ability to repair and recover if I wasn't fueling this fire of inflammation every
Right.
day, all day for years.
So then you made some of these diet changes. You started to feel better. And how did
Yeah.
you start incorporating other autoimmune components, gut stuff, hormone stuff? How did that come into the mix? Was this like kind of the first peek under the tent and you're like, well, how much better can I get? And you look deeper? How did that unfold?
Yeah, sort of like that. I sort of became addicted to, well, what else can I do? What else
Yeah.
can I have? And
What
how
what
can I?
else is there, right? Yeah.
Yeah. And so I started to just really become obsessed with this crazy newfangled concept called nutrition that I feel like nobody knows about. How come nobody knows about this? Nobody's talking about it. And so your listeners probably are like, wow, I just never thought of that either. Right. I
Right.
mean, it just was so revelatory to me. And so I started trying new foods. I mean, I literally had to look
Mhm.
things up. I subscribed to a farm box, and I was like, "What is this? A Romanesco cauliflower?" And I was like, "I don't even know what this is or what to do with it." But so I had to learn. I just became a really
Right.
good student, and I was still working in television at the time. And people would ask me, like, "How come you have so much energy and you're not doing what they're doing? How come you are not like with your head on the table?" And I wasn't eating the food that they were eating.
Right.
And so I sort of was becoming like the unofficial health coach on the sets that I worked on. And then I
Mhm.
was like, I wonder if I'm supposed to be doing something else. And then, the economy crashes and my shows start getting canceled. And I'm like, okay, I'm going to go back to school. And so I went back to school for nutrition, and I was just my first like patient zero, and
Mhm. Mhm.
trying everything, every different diet, every different theory, just to see like, what can my body do? One of the things that I know, you work a lot with hormone health, and one of the
Yep.
things that was an issue for me that I didn't think was an issue for me, or not in the way that it was presented to me. I was on the pill because I didn't get my period when I was in my early 20s, like late teens,
Mhm.
early 20s. I just wasn't getting it. That's concerning.
Yeah.
And so I went
Big
on the pill,
concern.
and I was like secretly happy about that because, like, hey, bonus, I won't get pregnant when I don't want to be. And
Yes.
so what I didn't realize is that I shouldn't be on it for so long, and that it was just
Right.
masking an underlying issue. And I had asked my doctor somewhere in my mid 20s, like, should I still be on this? And he's like, well, your body's going to do what your body's always going to do. So, and like, he's only half right there. So as long as you keep doing what you have
Right.
always done, your body's going to keep doing what it's always done. And so it wasn't until I was in nutrition school and I was still on the pill, and I'm like, I'm in my 30s now. I would like to have a baby. not today, but like I want to make sure that I can. So I
Yep.
think I should off the pill. And I did. Now, so during this time, I've already been working on myself, changing my
Yep.
diet, working on my gut health, pooping once a day,
Yeah. Yes.
not having the fatigue, all of this stuff. And
Yeah.
so I went off the pill, and it was like 28 days later, I got my period. But I had before that, I had ovulated for the first time in like uh, over a decade. I mean, it was the
Wow.
first time I knew that I ovulated because I felt it.
Yeah.
And, sweating and like writhing in pain.
Yeah.
And apparently that's textbook for the like coming off the pill, having this
Yep.
excruciating pain. And I've been regular ever since. And so I was like, ain't that something? Right. They told me when I
Yeah.
was 26 that it was always going to be like this. And at, whatever it was, 34, it was normal. I was like back to normal, not having any trouble anymore.
That's good. I mean, yeah, when you take lots of synthetic estrogens for decades, I mean, it can predispose you to fibroids and endometriosis. I mean, you're putting a lot of synthetic estrogen in your body. Now, when you were doing that, were you still taking the reminder pills at the end so you'd still kind of have a period?
Yeah,
Okay,
what
that's good.
I
So you weren't,
thought I was having a period. Yeah.
yeah, well, yeah, at least flushing out the endometrial lining.
Yeah.
And so then
Yeah.
you didn't have any post birth control syndrome symptoms afterwards. You kind of got back
No.
on healthy mood, healthy
Fortunately,
energy, healthy libido.
yeah, fortunately, that was all fine. And then I'm in school for a few years, and then I changed careers, and I started a nutrition practice. And then I was like, oh, hey, I'm 40. Like, how'd that happen? We forgot to have a baby. Like, we have to do this. And I had been working on myself. And because
Yeah.
when I was in school, anybody who was in my family, so hubby, hello, we're going to experiment on you too. And
Yes.
so we ended up getting pregnant within 3 months of trying.
Wow.
And,
That's great.
and that's at 40. So
Yeah.
I was like, hey, this works. This
Yeah.
stuff works. And of course, I didn't know that it was going to work out so well. But I do know that if I had tried to get pregnant in my 20s, it would not have worked
Right.
because I know how sick I was then. And I know that I felt younger. Like the older I get, I don't feel older. I definitely, because I identified with like an 85-year-old when I was 25 because I
Right.
couldn't walk up and down stairs. My colleagues had to carry me, and I was in New York City, and
Because
it's all up and
inflammation.
down stairs. Yeah, I was in
Right.
so much pain, so much pain.
So you had
Walking
the
around
fertility
sitting.
so you had the fertility challenge and just getting off the pill, was that enough for you to be able to kinda gain your fertility back, or did you have to use any bioidenticals or any herbal supports or anything nutrient-wise outside of the box there?
I didn't. I was really mindful of making sure that I was bringing in, like, let's say, B vitamins. I
Yep.
was bringing in lots of green, like it just anybody who knew me before would never believe that this is how I ate, but a lot of whole foods rather than I used to subsist on a lot of packaged and processed foods. And it was whole foods. I did bring in evening primrose oil. Like I was trying to like support progesterone
Yep.
because I know that, these things, they do decline, like facts of life, they do, but they don't have to at the rates at which they do for a lot of women
Correct.
because we're not paying attention and we're
Mhm.
not looking at the signs and we're not feeding us things that are going to help to support and modulate our hormones.
Right. Okay, so you have this journey, you have this fertility journey, so you get pregnant. How many kids do you have? You have 1 child, 2?
I have one working
Great.
on number two, but yes, one.
Oh, great. Awesome. That's cool. And so then based on your journey and kind of where you're at, who are the patients that you typically attract? Are you attracting a lot of women with hormonal related issues, or are you seeing a lot more chronic type of illness or with an autoimmune gut component? How does that match?
Yeah, I do see a lot of, I think when I was documenting my pregnancy, it was a lot of those women were coming,
Yeah.
but it's usually the people who have been struggling. We call them big bigs. So people who have big struggle and they put big effort toward finding resolution toward healing for a long period of time, and they're just not getting answers. And so those tend to be the people that I attract because I relate so much to that chronic health struggle. And it's so funny because most people will assume, probably for you too, that like, well, you've always been this way. You've always been so healthy and and that wasn't the case for me at all.
I think it's very easy for someone to see and look at someone who's not like obese and just assume, okay, they must be healthy, they must feel great. And there's a lot of people that look healthy, but on the inside they're dying. They don't feel that good. They don't feel energized, or their mood, or their irritability, or they have hormonal rhythms that make them feel incredibly unstable, or
Yep.
cognitively they can't focus. I mean, that's a big thing. And it's like, how do you feel on the inside? That's really the key thing. And I imagine you noticed a big shift once you started making these changes. Probably one of the big first symptoms you noticed outside of just the overall inflammation in your body dropping.
100%. And but one of the
Mhm.
driving factors, and this sort of takes a sad turn in our conversation, is that one of the pain points that I had, and driving forces for what I do now and making this shift, was that my dad, who looked like the healthiest, most
Mhm.
muscular, and he was active and happy and vibrant and all of the things, non-smoker, non-drinker,
Mhm.
he died at 50 years old.
Oh, wow,
And
that's really young. So you must have
really,
been what at the time, 20?
I was in my early 20s,
So you're
and
young.
yep, I was young, and it blew us all away because it was
Wow.
not expected. There were no signs. He wasn't sick, or at least he never complained of anything. And so it speaks exactly to your point, is that people can look perfect on the
Yeah.
outside, which he did. He was dying on the inside. We had no idea he had
Wow.
severe heart disease blockages that nobody looked for because he was so athletic. And the assumption was he doesn't need to do a stress test, because even though he turned 50, cholesterol was good, colonoscopy was good. So, and his doctor said, you don't need a stress test. You do one every day. Not hooked up
Right.
to monitors. He
Right.
doesn't.
What was his diet like? Was he eating just like a lot of the typical food pyramid, lots of gluten, lots of processed stuff?
Yes, yes. And also fat free.
Ah, that's a big one. Because if you're not eating fat, you're eating a bunch of processed carbs, and then also you need healthy fats to run your hormonal system, right? Yeah, it's a big one.
Well, and whenever I see, and this is a drum that I'm always sounding, because I didn't
Yeah.
know it then. We just didn't know. I didn't know what I didn't know, and I was leading the charge for fat free. It made so much sense. That's what everybody was
Yeah,
saying.
that was the 90s, right? 80s and 90s. That was a big thing.
Yes, and so when you don't have fat in your diet and you have heart disease, your liver is going to make more cholesterol. You're going to have more plaque because your liver is actually unsupported. It's your liver that needs that fat. And so whenever people are like, I have high cholesterol, I'm like, don't look at your heart. Let's look at your liver. Let's address that, because he probably had fatty liver disease.
Yep.
He definitely had heart disease, and he was not detoxifying properly. Like, I just, like, looking back, it was a standard American diet. It wasn't that it was like
Yeah.
McDonald's all the time, but there wasn't a lot of veggies. There wasn't very much fat, except for like the chocolate ice cream that he would have at night, right? But starting a day with bagel and coffee.
And when you're
That's
surging insulin, if you're not eating a bunch of fat, then you're eating a lot more carbohydrates that are processed. What
Mhm.
sounds like your history, there's probably a lot of gluten sensitivity there. So he's probably eating a lot of gluten. And when you're surging insulin, he's exercising, it's helping. But when you're surging insulin, it's very inflammatory on the vasculature. Yeah, that makes sense.
Yeah. 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 Now it does.
Yeah. Oh,
But it
yeah, I know,
didn't.
right? Hindsight's 2020. I know. I get it.
Yeah.
I
And
get
so
it.
that's really important to me, is that, like, yeah, of course we all want to look good, but we also have to make sure that we're good, we're healthy on the inside.
Right.
And it doesn't always manifest as fat. In other people, you can be perfectly lean, but also have all of these other symptoms that we might poo poo because, well,
Hmm.
everybody has fatigue, or everybody has brain fog, or everybody has a little joint. I'm getting
Right.
old. So, that's why my knees hurt. And it's like, no, they don't have to. They
Right.
don't have to.
Right.
Yeah.
So you have your dad's past, like so. Then
Yeah.
let's talk about kind of the autoimmune components, right, and the gut health component. How did that kind of become an instrumental thing for you to look at or for you to dive down? Was that something that you had a personal experience with, or were you just dealing with a lot of people that had a lot of chronic gut issues and you had to dive in deeper to figure out what was happening?
That yes, you're good.
Yeah.
Yeah,
Yeah.
that's exactly kind of how it happened, because I was in school and starting to see patients and working with more and more people. And so oftentimes I fortunately did not have any autoimmune. We thought
Okay.
so.
Good.
When I was going through all of my struggles, well, I did have Raynaud's, so my fingers would turn white whenever I was
Okay.
exposed to cold. So I did have
Any
that.
Hashimoto's with that? Usually that's associated
I
with Hashimoto's.
I
Nothing.
didn't. No, I didn't. But they were wondering about lupus, like all of these, because I had
Hmm.
so much pain. However,
Right.
it was the diet and lifestyle that moved the needle the most for me. I was toxic. I was toxic. I was nutrient deficient and toxic.
Okay.
Um, but so what I find is that a lot of my clients with these mystery symptoms or chronic illness, there's always autoimmune. If not a diagnosis that they have, it's in their health history. It's their
Mm.
mom, their grandma. So even if undiagnosed, and I'm like, and I have had to, and I'm not a doctor, but I know how to read labs, and I will look at things and say, hey, you may want to ask them about this because I see
Right.
antibodies off the charts. And so I've
Yeah.
had this a couple of times where I've diagnosed Hashimoto's, but I have to like refer them back to say, like, this is concerning. Go
Right.
ask. And then one of my clients said, oh yeah, we know, but she was already on thyroid meds, so they never like talked to her about it.
Right.
And I'm like, because once you have one autoimmune, you're gonna have three. So
Yep.
like, let's address it instead of just give
Yeah.
her thyroid meds and like she's fine. Like that's it. That's not it. She's clearly not
Right.
happy because she's sitting in front of me. Right?
Right.
Her body doesn't feel happy. Her life doesn't feel happy. So, and that's where I sort of fill the gap, functional as a functional nutritionist, filling the gap between like where the doctor is and like where the patient or client is. Like, okay, now what do I do? How do I even make this work? And what? I'm so overwhelmed. And am I doomed? And like, usually no. Usually the
Mhm.
answer is no, you're not doomed. Right? There's things that we can do to be proactive and reverse, if not just sort of mitigate all of these symptoms and give you tools so that if and when symptoms come up, you know what to do. And like flares would be fewer and farther between.
Yeah, I think people make an assumption that if my medical doctor did not tell me about this, then it must not be something important. Most people don't realize that your average medical doctor has virtually zero education in nutrition at all in their curriculum. And if there's any connection to nutrition, it has to do with a disease state like vitamin C and scurvy or B1 and beriberi, right? It has to do with more pathology versus like function or functional medicine, right? Functional physiology, if you will. So people make that assumption. And then, you look at let's say you go into the dietitian world. If you ever go to a dietitian seminar, right, you're going to see Kellogg's and General Mills and Mars Corporation. They sponsor these events, and so the whole idea is right, balance and moderation, so we can still promote dietitians to kind of pitch our junky processed food if it's only a little bit, right? And so yeah, I get that, and people really they don't know who to get advice from, and it's stuck. People are stuck between a rock and a hard place, and I think practitioners like myself and yourself, they come across on YouTube or podcasts, and they're kind of talking a different story.
Yeah. And that's what I think attracted me to functional medicine. I was in nutrition school and I learned about IFM, the Institute for Functional Medicine,
Hmm.
and just it,
Mm.
because it was an emerging concept of like patient-centered healthcare and how there's like bio-individual approach. And I was like, ain't that something? How come no? Because they were trying to fit me. I had no diagnosis. So I wanted one because I didn't know what was wrong with it. For 10 years, I struggled with unexplained chronic pain. I had 7 MRIs. I told you I saw all of the people, all of the top docs, the orthopedic surgeons. And it wasn't until they recommended exploratory surgery on my knee because my tear
Right.
wasn't
Was it
consistent.
meniscus? Was it meniscus or?
Yeah, I had meniscus tear.
Mhm.
And so I had one doctor say, well, we should cut it. And I said, well, or we should do surgery. And I said, what do you do? And aren't you just cutting out the frayed part? They said, yeah. And I said, well, if there's less, isn't it going to just tear again? Because I hear that most people go for like multiple knee surgeries. He said, well, yeah. And I was like, okay. And so one of the doctors said, because I went for 2 opinions, and one of them said, or, and I was like, or, he's like, you can strengthen the muscles around your knee and try to support it. I'm like, that sounds like a better idea.
Yep.
But because when I had all these different things wrong, and in Western medicine we segment the body into you. So I'm having migraines, so go to a neurologist. I'm having this like numbness, go to a neurologist. I'm having knee pain, go to an orthopedist, go to a physical therapist. Like it's all different. I never had anybody talking about digestion, which is where everything is coming from. At least that's in functional medicine. We know this to be true. It's where your immune system is. It's where all of the information
Yep.
that you feed your body disseminates that information throughout your body.
Right. Right.
So I was learning about functional medicine. I'm like, this would have saved me 10 years of pain and struggle and money had I known that my diet was crap and I needed to make changes and I needed to sleep because I wasn't sleeping. So, all of these like basic, simple things. And I think maybe specialists think that those are too like, oh, well, those, like it's the more complicated stuff. And they couldn't figure out what was wrong with me. And meanwhile, it was all of these basic fundamentals of health that I did not have in place at all.
Yeah, the issue with diagnoses in general, if you look at most diagnoses, they don't really connect to a root underlying issue. A lot of times they just give you a, like, for instance, if you came in with a joint issue, right? And they may just say, hey, you have arthritis. And it's like, well, that literally just means joint. Arthro means joint, and itis means inflammation. It's like, no crap, I have inflammation there. That's the pain, right? Or they may say, oh, it's meniscus. But then, what's the treatment, right? Does the diagnosis get you to a treatment that addresses the root cause, or is it a treatment that is managing symptoms as you slowly decline? Most conventional medicine diagnoses are about managing symptoms as you slowly decline, and then we know what happens with decline. You need either more stronger drugs or higher dose as you decline, and usually then you deal with side effects of the drugs as you're managing the decline. Then you have more drugs treating the symptoms, and that's most people are in this kind of loop.
Yeah.
And conventional medicine is great for acute issues when it's an acute one-off. I got in a car accident. I broke my arm. The underlying cause of why my arm was broken was the car accident. That's not happening anymore. Therefore, treating the broken arm with a brace, surgery, whatever, cast, that fixes the underlying cause. But most of our conditions are chronic. There are little car accidents happening every single day, all the time. So if you go in to manage this blood sugar issue or this chronic memory issue, right, and you're not fixing the underlying car accidents happening every day with our chronic health challenges, then you're never getting to the root cause. And so conventional medicine does wonderful where the root cause is isolated, not when it's chronic and happening over and over at a micro level every day.
Yeah. And the beauty of it is when you're using diet and lifestyle, it's so funny when people are concerned about, like, can I eat this? Is it safe?
Mm-hmm.
Or even like a nutraceutical that's just like food. And is this even safe? It's not FDA approved. And it's like, it's not a drug, it's food. And yes, obviously some foods will counteract it, especially if you're on a medication, right? And so like there can be, but usually when you're bringing in food or you're able to break down and absorb the nutrients in your food, then instead of having a cascade of more and more symptoms, like you watch the pharmaceutical commercial and it's like 100 things long, including death might happen. Instead, you're having a ripple effect of like, well, that feels better. That feels better. I love this story. I have a client who's an eye doctor. She didn't know that she was dehydrated. Her eyes, she always suffered from dry eye and didn't realize that she was dehydrated. She was drinking, I think, between 2 and 4 cups of tea a day. That's it.
It's dehydrated.
That's it. And so we had her drinking water and she's like, my hair is shinier. I can see better. And she's an eye doctor. And I love her. I love that she was so open to consider something as simple as that in her expertise she'd never considered, right? Because she wasn't taught that.
Yeah, it's amazing when you work with patients and you just kind of work on the low-hanging fruit, right? You get the hydration dialed in, whatever your amount, half your body weight in ounces is probably a good general recommendation. Adding some electrolytes in there is great. Dialing in, your good anti-inflammatory whole foods type of dietary template. Really focusing on good macros, getting enough protein, getting enough good quality vegetables, getting a little bit of movement, getting your sleep dialed in. Just the foundation of that alone. Forget anything fancy on the functional medicine side. That sets the table for a lot of magic to occur if someone's eating kind of the standard American way.
Yeah. And that's the thing. That's the place that we start. And usually when people hear that, I work in, I'm a functional nutritionist. And so the first question is always, oh, so you can run functional labs? And yeah, I can, but I'm not going to start there. There's so much fun tools out there, right? There's so many fun labs that we can do. And if wishes were fishes and your pocketbook was really deep, like, oh, let's just see what's going on in there. But is it necessary? No. And it's usually not right now because of all of the things that you just described. Like they don't have blood sugar balance. They're not pooping. They're not sleeping. They're not hydrated. Yep. So let's work on those first that we call non-negotiables. Let's work on that first. And then when we're like, I think there might be infection here, or maybe there's mold, or like maybe there's food sensitivity. Like what's happening here? Then we bring in testing to figure out like either to confirm something that we already assumed, or to just rule something out. But usually the basics have not been tended to.
What's your approach to assess and or help patients with mold issues?
So, well, first it's all of the things, right? Making sure that the toxic tap is turned off. So, like,
Mhm.
let's start with your home. Like, is there a
Yeah.
leak in your home?
Yes.
Like,
Yeah.
was there rain? Is there, something that needs to be fixed? Has there been? And oftentimes there will be, right? And then, of course, then we would do testing, right? So we would do. So there's either an oats test, or what is it? It's Genova has a.
There's some urinary mycotoxin tests out that look at mycotoxin in the urine.
Yeah, yeah. Is that Genova?
They may have that one. The one I use is by Mosaic, but I think Real Times
Oh,
Lab has some. There's a couple that are out there by some different
yeah,
companies where they'll look at the
yeah,
mycotoxins coming out in the urine.
yeah, yeah, yeah. So, yeah, that's that's where we start. But when you have mold, so that's nasty, right? That's really, it
How do
can
you look at
really.
some? How do you guide people to help their look at their house? Do you do any different testing inside their home, whether it's like plate or ERMI testing? Like, what's your take there?
So there are definitely. I have a few resources that I will point people to, like have these
Hmm.
people come to your house and see, because there are kits, but I don't know necessarily how accurate they are.
Hmm.
We had a mold situation actually while I was pregnant. We had a mold
Oh
situation,
wow!
and so and fortunately, like I had no problems. I must have good genes. I must have good genes, because I've definitely been through a lot, or what I do for it is helping. But
Only a third
you
of the population really is sensitive to mold, where they like get foggy, have the neurological kind of issues. So
yeah,
most of the population isn't. And that's the part of the hard thing because it's just you get all it takes is a husband and wife, and let's say the wife has all these issues, and the husband's like, "I'm fine, this is good." Like, why are we spending $100,000 on this? Like, I've
right.
I've seen that be a major stressor on relationships because it's literally not impacting someone else and it's impacting the other person, and then it's hard to see sometimes. You may not even be able to see the mold unless it's a really acute leak intrusion. It could be at a subclinical level where you can't even see it.
Right. Well, it could also be from something in the past. I had a client,
Hmm.
she had severe, like, just cognitive issues. She ended up having to take a sabbatical from work, because she worked
Oh
in
yeah,
healthcare. She couldn't function. And through our health history, that we do a very
yeah,
thorough health history, and she had lived in an apartment by the beach, and they suspected mold, had a big fight with the landlord, ended up moving out, but she really thought that there was black mold there. But she's like, but this is years ago. It was like 3 years prior. And I was like,
right,
I think that was part of the problem with you.
yeah,
But sometimes it's like, how do you feel when you're not in? So sometimes it comes with you because it's in there
yep.
and it's insidious. But sometimes it's
How do
like,
you feel when you're out? How do you feel when you're out? And
better
I'll
when
do
you're
plate
out.
testing to see what's going on with plates because that can be helpful. And also you can have a mold with just high levels of humidity and then just having dust in the air. All you need is oxygen, moisture, and food, carbohydrate. And so
Oh,
dust and moisture is going to be there if the
yeah,
humidity, and then if everyone's going to have oxygen unless it's contained, right? But that's
yeah,
it. Yeah.
yeah,
So yeah, I get that.
yeah, yeah. So it's nasty. And so, if somebody has low stomach acid, if
Yeah.
somebody is malnourished, if um, that's going to set you up for infection, overgrowth, right? And so, again, that's why we start with these basics. And if we know that these things haven't been in play, and we look at somebody's history and we're like, yeah, there's quite possibly mold here or infection here. But again, in order to be able to treat it, like to go through a kill, to
Yeah.
detoxify that, you have to be stable. You have to have that foundation of support before we can do anything like that. Because I usually get the people who have been through kills with previous doctors who didn't address any of that other stuff, and they were sicker after. And then we have to back it up, start here, get them to a place where they're feeling better, knowing not that it's curing anything, because we still have to kill,
Right.
but they are better able to handle, to just withstand bringing in killing agents and really creating a war zone in their
Right.
digestive system.
Yeah. Also, a lot of the mold detoxification is going to happen hepatobiliary. That means liver gallbladder, which dumps into your gut. And if you don't have good gut function, then you're going to reabsorb a lot of this stuff. Also, the beneficial bacteria in that gut has a way of neutralizing some of these mold toxins. So the more beneficial your bacteria is, good liver gallbladder function. Now, if you get exposed to mold, well, now you're eliminating because you have good motility, you have good detoxification, glutathione, and acetylation, but then you also have the bacteria balance that's also helping to neutralize it too. Because we run some of these organic acid tests, you probably do too, where you see a lot of colonized mold. You'll see this
Yes.
aspergillus or fusarium kind of colonized in the gut, where your gut's almost a factory of making mold.
Yeah. Yeah. And so again, depending on what the symptoms are, so like if I see a lot of skin rashes, I
Yeah.
know there's something going on in your gut. And
Oh,
people,
absolutely.
they want the
Yep.
cream, they want the pharmaceutical, they want the whatever. I'm like, that's fine and all, but that's not going to fix it.
Got to
It's
get to the
coming from,
underlying issue at the
yeah,
same time.
yeah,
Ideally, do both or do something more natural on top and then hit the internal side of the fence too. I agree.
right. And so when it gets to that point, we've done all of the things, and then it's like, yeah, okay, we have to find out what exactly is in there, so we know what
Right.
it is that we're killing and how best to kill it, not
Right.
just blanket kill because you won't necessarily get it, or it might be resistant to whatever agent you're using.
I agree. Well, anything else here you want to leave us with, Allison? Any other big topics or big other issues you want to touch upon?
I would just say, we can't talk about nutrition without digestive function. And a
Yep.
lot of people are just like, just tell me what to eat. And
Right.
it really depends on what you can do with the food that you eat, what your
Yes.
body can do with that food. And so, we got
I
to get
agree.
the nutrition into your cells. And we can do that. We can do that in ways that are easy, fun, and sustainable. That's my thing. And I want to make it easy for you, even if you have been struggling for a long time or super picky eater, because I was once too.
Awesome. Well, if people want to find your website, is that chronic relief or chronicillnessrelief.com?
Yes, yeah. And I'm Health Alley on social media, on Instagram, Facebook, YouTube, chronicillnessrelief.com. So I do have a gift for your listeners, if that's
Oh, cool.
okay.
Yeah, it's great.
Yeah.
We'll put the link down below for the site as well as the gift.
It is my chronic illness recovery guide. And so it's the 5 steps that I took. It won't take you 10 years to figure it out. It took me that long, but these are the 5 steps where you can begin to heal. It's your roadmap to healing.
Great. And what's the link for that?
chronicillnessrelief.com. You can
It's
get it.
right on the homepage. There'll be like a little button there for it.
Yeah.
Good. All right. We'll put that link there so everyone
Yeah.
gets it. All right.
Cool.
Excellent. Allison, nice chatting with you. Very nice
You
chat.
too.
Really appreciate your experience. It's always fun to understand how other people kind of made their way to into the functional medicine field. It's kind of that bond that us practitioners kind of have. We've gone through that ourselves personally. So I get it. That
Yeah.
makes sense. Cool.
Yeah. Yeah.
Anything else, Allison?
No, that's it. I appreciate you being here. I love the work that you're doing, and the people that you've studied with, or the people that I go anytime there's a lecture, I'm there when they're speaking. So I am a big fan, and I appreciate what you do. Thanks so much.
Thanks, Allison. Really appreciate it. Take care.